So when do you do a temporal artery biopsy? It's most of the time your neurology colleague who asks you for a biopsy, and it's done in a not so uncommon condition called as giant cell arteritis or temporal arteritis. So when exactly will you schedule the biopsy? If they're going to start steroids, it is ideally done before starting steroid therapy. But in case if steroid therapy had to be started urgently to say, for example, to save vision, then at least you should do the biopsy within 2 weeks of starting the steroid so that you get the correct diagnosis. So which part of the temporal artery will you send for biopsy? So temporal artery is something which we see day in and day out during almost all our procedures. So it has a main trunk, it has a frontal branch, and it has a parietal branch. So ideally, you should be doing it, you should be removing the frontal branch. But of course, if some other branch is more painful, it is worthwhile removing that branch and sending for biopsy. But otherwise, it is always better to remove the frontal branch and then send for biopsy. However, sometimes even if the patient is having temporal arteritis, the biopsy can be negative. So if the clinical suspicion is high and still the biopsy is negative, it is worthwhile to go ahead and do the biopsy on the other side as well, which can increase the yield by 5 to 10%.